Heart surgeon alert. The medication. Silently damaging the hearts of seniors. Look at the bottle in your medicine cabinet right now, the small white one. The one you reach for when your knees ache in the morning, when your back locks up after gardening, when your hands feel stiff and your shoulders scream from a lifetime of work. You bought it without a prescription. You trust it because it is on every pharmacy shelf in the country. You believe it is harmless because, after all, it is only for a little pain. But what if I told you that for the heart of a person over the age of 60, that little pill is like pouring a thin stream of sand into a finely tuned engine every single day until the engine begins to grind, and one morning it simply stops? Today, I am going to explain, in the plainest words I know, why a medication millions of seniors swallow as casually as a glass of water may be quietly damaging the very heart that is still trying to love them. And before we go any further, I want you to know something important about this conversation. I do not want you to feel afraid. I want you to feel informed, because the truth is, no one ever sat down with you and said, "Dear friend, here is what this pill does once it crosses the doorway of a body that has passed its 60th birthday." No doctor brushed your hand and walked you through the chain reaction that happens inside your chest every time you take it. No pharmacist pulled you aside and said, "This medicine was tested mostly on people half your age, and we are now learning what it does to hearts like yours." That is not your fault. You trusted the system. You trusted the white coat. You trusted the little bottle with the familiar label. And now, together, we are going to open that label, read the tiny print that no one ever read to you, and finally understand what your heart has been trying to whisper to you for years. If this video helps even one of you walk into your next appointment with stronger questions and a clearer mind, then it was worth every word. And please know, you are not alone. You have just joined a quiet but growing family of seniors who have decided that their golden years deserve better information, and I am honored to walk this path with you. Let me tell you a little story about how the body works, because once you see this picture, you will never look at that little white pill the same way again. Imagine that your body is a beautiful old house, and inside that house there are 3 quiet workers who have kept everything running for decades. The first is your heart, and the heart is a pump. Not a fancy pump, just a strong, faithful muscle that squeezes about 100,000 times a day, pushing your blood through 60,000 miles of pathways so that every cell in your body can eat, breathe, and live. The second worker is your blood, and the blood is a river. It carries oxygen, it carries warmth, it carries the food your organs need, and it gently washes away the waste that your cells throw away every single second of your life. The third worker is a pair of filters sitting just below your ribs, your kidneys, and these filters are like the coffee filter you use every morning, straining out the impurities so that only the cleanest fluid returns to the river. For most of your life, these 3 workers knew their dance perfectly. The pump squeezed, the river flowed, the filters cleaned. But after 60, something changes. Something our grandparents never had a word for, and something medicine is only now learning to name. Inside the body of a senior, a slow, invisible fire begins to burn. Scientists call it chronic inflammation, but I want you to think of it as a fireplace that was lit on a cold winter night and never quite put out. The fire is gentle. It does not roar. It does not alarm you. But every night, it warms the walls a little too much, dries the wood a little too much, and over months and years, the house begins to creak in places it never used to creak. That creaking, my friend, is the soreness in your joints, the swelling in your ankles, the tiredness in your chest when you climb the stairs. And so you reach for the little white pill because the fire is uncomfortable and the pill is right there and it promises relief in 20 minutes. But here is the part no one tells you. That little white pill does not put out the fire. It only hides the heat for a while. And while it hides the heat, it does something very quiet and very serious to the pump and to the filters. Now, before I tell you what it actually does, I want to ask you something personal. Take a moment and drop a comment below with the name of the city where you are watching this from. I do this because every single comment is a heartbeat in a growing movement of seniors who are tired of being told half-truths, and I want us to feel the strength of that movement together from coast to coast. And now we arrive at the heart of the matter, and I am going to say this slowly because it deserves your full attention. The medication I am talking about is the family of drugs called NSAIDs, which is short for non-steroidal anti-inflammatory drugs. You know them by their friendly names: ibuprofen, naproxen, diclofenac. The orange bottle, the little white tablets, the gel you rub on your knee, the packet you buy at the gas station when your back seizes up on a Saturday afternoon. For decades, we have treated these pills as if they were vitamins, as if they belonged in the same category as a glass of orange juice. And for a young body, a heart that is 30 or 40, a kidney that is filtering at full speed, the risk is small enough that we barely mention it. But after 60, the body is no longer young. The river flows a little slower. The pump squeezes a little harder to push the same amount of blood. The coffee filters are thinner, more delicate, and they hold less water. And this is exactly where the problem begins, because these little pills work in a sneaky way. They do not attack the heart directly, they do not punch the pump. Instead, they quietly block a group of natural oils your body makes called prostaglandins. These oils are like the lubricant that keeps your pipes flexible, your filters open, and the lining of your blood vessels soft and relaxed. When you take that pill every day, those oils shrink, the pipes stiffen, the pressure inside the river rises, and your pump, which was already working harder in your 60s, now has to push against a wall that is closing in. Scientists call this raised blood pressure, but I want you to picture it as a garden hose with a foot stepping slowly on the opening. The water still comes out, but it sprays harder, it strains the nozzle, and over time, the hose begins to crack at the weakest point. In your body, that weakest point is the heart itself and the vessels that feed it. Now you might be asking, Doctor, I only take one pill. How could one pill hurt me? And I understand that question because I hear it every week in my clinic. I hear it from a sweet 72-year-old woman named Carmen who came to see me last spring because her ankles were swollen and her heart felt fluttery. Carmen had been taking 2 ibuprofen tablets every morning for her arthritic knees for almost 8 years. She thought she was being responsible. She thought she was avoiding stronger medicine. But when we looked at her blood pressure, it had climbed 20 points. When we looked at her heart, it was beating irregularly. When we looked at her kidneys, they were struggling. And the moment we slowly, carefully worked with her doctor to transition her to safer options for her heart, the swelling in her ankles faded, the fluttering calmed, and Carmen told me with tears in her eyes that she felt 10 years younger in just 6 weeks. Carmen is not a story I invented. Carmen is a story I see in different versions every single week. And so I want to ask you right now to do something small but powerful. Hit the like button on this video, not because it helps me, but because it pushes this truth past the algorithms and into the living rooms of other seniors who still believe the little white pill is harmless. Your like is a quiet act of love for a stranger you may never meet. So if this medication has been quietly pressing on the garden hose for years, what is the actual damage? Let me walk you through it the way I walk my own patients through it. Slowly, gently, with no scary words. The first thing that happens is that the pressure in the hose rises. Your blood pressure goes up, often by 5, 10, 15 points. You do not feel it, you do not see it, but every time your heart squeezes, it squeezes against a heavier load. The second thing that happens is that your body begins to hold on to water. These pills whisper to your kidneys, telling them to grip the fluid a little tighter so the rivers inside you swell. That is why your ankles feel puffy at the end of the day, why your shoes feel tighter, why your rings press into your fingers. The third thing that happens is that the lining of your blood vessels, which used to be as smooth as the inside of a drinking glass, becomes a little rougher, a little stickier. And when a river flows fast against a rough wall, little bits of plaque begin to gather at the curves and bends. The fourth thing, the one that concerns me most as a heart doctor, is what happens to the rhythm of the pump itself. These pills can change the electrical signals inside the heart, the tiny messages that tell it when to squeeze and when to rest. Instead of a steady drum beat, the heart begins to skip, to flutter, to stammer. And in a senior, that stammer is not just uncomfortable, it is dangerous. It is the kind of danger that sends people to the emergency room on a Tuesday afternoon because their heart decided to race while they were watching television. Now, the FDA, the Food and Drug Administration, the very agency whose job is to protect you, strengthened their warning about these pills back in 2015. They said in plain language on their official website that these medications increase the chance of heart attack and stroke, and that the risk can begin as early as the first few weeks of use, and it grows with every passing month and every higher dose. They also said that older patients, compared to younger ones, are at greater risk for serious heart, stomach, and kidney problems from these drugs. That warning has been sitting in the fine print of every bottle for almost a decade, and almost no one has ever read it out loud to you. I am reading it to you now, and I am not telling you this to frighten you. I am telling you this so that the next time you stand in that pharmacy aisle, you will not be the same person who walked in 5 minutes ago. And remember, dear friend, never stop a prescribed medicine on your own. Always talk to your doctor before changing anything, because your heart and your history are unique and only your doctor can guide that conversation. And now, my friend, we get to the part of this video I am most proud of, because this is where we turn fear into action. If the villain of this story is the casual daily use of these pain pills, then the heroes are the 5 small steps I'm about to share with you. These are not extreme steps. They are not expensive steps. They are small, kind, daily choices that protect the pump, calm the river, and respect the filters. And every one of them should be discussed with your own doctor before you begin. Step 1 is the conversation step, and it is the most important one. The next time you visit your doctor, and I do not care if it is for a checkup or for a cold, I want you to bring every pill you take. Not the ones your doctor prescribed, those are already in the file. I mean the ones you buy on your own at the pharmacy, the little white ones, the pain gels, the headache powders. Lay them on the table and ask your doctor, with love and not with accusation, is this one still safe for my heart, given that I am now in my 60s, my 70s, my 80s? A good doctor will smile at that question. A great doctor will be proud of you for asking it. Step 2 is the food step, because food is the original medicine, and it has been quietly protecting hearts for thousands of years. When your knees ache, instead of reaching for the pill, try a plate of fatty fish, salmon, sardines, mackerel, twice a week. The oils in those fish are like lubricant for your pipes, and they fight that slow fire I told you about, the chronic inflammation, in a gentle, sustained way. Add a handful of walnuts to your morning oatmeal. Sprinkle turmeric on your roasted vegetables. Sip tart cherry juice in the evening. These are not folk tales. These are foods that have been studied in major universities, and they have shown real, measurable reductions in the same joint pain that pushes seniors toward the pill bottle. Step 3 is the movement step, and I want to say this carefully because I know that for some of you, movement is painful and movement is scary. I am not asking you to run a marathon. I am asking you to walk slowly and gently for 20 minutes a day, around the block, around the garden, around the mall. Walking moves the river. Walking wakes the filters. Walking reminds the pump that it still has a job to do, and that it is still loved. Step 4 is the ice and heat step, because for many seniors, the pain in the knees and the back responds to a simple bag of frozen peas wrapped in a towel or a warm towel rested on the shoulders for 15 minutes. These cost almost nothing, and they do not cross the doorway of your heart. Step 5 is the sleep and stress step, because nothing destroys a heart faster than loneliness and bad sleep. Call a grandchild tonight. Call an old friend. Watch a show that makes you laugh. Sleep with the window cracked so the room is cool and dark. These are not soft suggestions. They are medical instructions, and they are among the most powerful heart medicines we have. Let me tell you about a man I will call Paco, because Paco taught me more about courage than any textbook ever did. Paco is 78. He had been on naproxen for over a decade for the arthritis in his hands. His blood pressure was stubborn. His ankles were swollen. His heart was locking into a rhythm I did not like. We did not take anything away from him overnight. We worked with his doctor. We shifted him slowly, with medical guidance, to a topical cream that did not enter his bloodstream as much. We added the salmon, the walnuts, the turmeric. We started him on a daily walk with his daughter. And within 4 months, his blood pressure dropped 11 points. Within 6 months, his heart rhythm settled back into that steady drumbeat. And the last time I saw Paco, he held up his hands, opened and closed his fingers, and said to me, "Doctor, I am holding my granddaughter again without pain." That is what we are working for. That is the whole point. And now, my dear friend, share this video with one person you love who is over 60. Your brother in Phoenix, your sister in Madrid, your neighbor who complains about her knees every Sunday. Send it to them with a short message that says, "Watch this one for me." You might be saving a heart tonight, and you might be saving a life. And so here we are, my friend, at the end of this conversation. And I want you to close your eyes for a moment and picture yourself 3 months from now. Picture yourself waking up in the morning without that flutter in your chest. Picture your ankles sliding easily into the shoes you love. Picture walking to the mailbox and back without pausing to catch your breath. Picture the numbers on your blood pressure cuff, lower than they have been in years. Picture your doctor smiling at your next visit and saying, "Whatever you are doing, keep doing it." That future, my dear friend, is not a fantasy. It is the natural result of small, kind, daily decisions made by a person just like you who decided that their heart still had decades of love left to give. You have earned these years. You have raised the children. You have built the homes. You have survived the losses. And now, it is your turn to be taken care of. And that care begins with information. And information begins here, in this quiet moment between the two of us. From the bottom of my heart, I bless your morning, I bless your meals, I bless your sleep, and I bless every beat of that faithful, patient, loving muscle inside your chest. You are not too old. You are not too late. You are right on time. And if this video moved you, subscribe to this channel, because next week I am going to sit down with you again, and we are going to talk about a different everyday pill pill that is silently overworking the kidneys of seniors. The same way, with the same honesty, with the same warmth, and you are not going to want to miss it. Take care of yourself, and I will see you very soon.